All right, none of them is ready to introduce themselves. We now begin in the name of
Yeah.
Our Lady, Queen of Singles. Pray for us.
Pray for
In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen.
Once again, I welcome you all to this seminar for singles on the theme surrogacy and egg donation. Without wasting much time, I welcome the speaker. Tonight we have two speakers. We have Mrs. Adobe Iro and Reverend Sister Priska Ovat. Both of them will be speaking on the issue. And we have a contributor, Dr. Francis Achebe, who shall be speaking to us on egg donation too. I invite us to mute ourselves, please. Everyone remain muted. I have announced this over and over again. Once you come to a program like this, remain muted. Remain muted. I have muted everyone now. Please don't unmute yourself, please. Remain muted. Thank you. I now invite Mrs. Adobe Iro to begin her presentation. Mrs. Adobe, are you there?
Yes, I'm here, Father.
All right, so you can now share your slides.
Okay.
Good.
Please, can you all see the slides?
Yes, we can.
Okay. Yeah, good evening, everyone.
Good evening.
My name is Iro Adobe. So I'll be taking us through this night on the topic is surrogacy and egg donation, but I'll be talking precisely on surrogacy. Then the next speaker will speak on egg donation. Okay. Okay, so the first thing we're going to look to talk about tonight is understanding surrogacy. You know, I know surrogacy is like most of us here have heard about the word, you know. So we are going to explain it before we go to the other ones. So surrogacy is an assisted reproductive technique by which a woman known as the surrogate carries and delivers a child for a couple, you know, known as the intended parents or individual. So the person delivers for couples and individuals. So the process can be commercial, meaning that the surrogate is financially compensated, or altruistic, meaning that the surrogate is not financially compensated. So this process, different countries have different ways of doing this, but we know that in Nigeria, most of the surrogacy we know is normally commercial. So surrogacy is done in different parts of the world, including Nigeria. So let's talk about those that are involved in surrogacy. Number one is the surrogates. That is the person that will carry the child. We have the intended parents or parents. We have the egg and sperm donor. We have the surrogacy agency. Surrogacy is not something that is being done by individual. You have to go through an agency. We have fertility centers. We have the lawyers or the legal counsel. We have pregnancy care practitioners. We have mental health providers. So these are the people that you know normally forms the team for surrogacy. Now, let's talk about the two types of surrogacy that we have. The first one is traditional surrogacy. So in this process, the surrogate egg is fertilized with the sperm of the intended father or egg donor. So this fertilization can be done by sexual intercourse or by artificial insemination. So here, the child is genetically related to the surrogate. In this process now, the egg of the surrogate is used. So that is why the child is genetically related to the surrogate. Then we have gestational surrogacy. This is the commonest one, because traditional surrogacy, when you look at it, you know that a lot of things can go wrong in the process. When a mother is carrying, it's like she is carrying her own child. So a lot of things can go wrong. But this gestational surrogacy now, it's a process where the embryo is created by IVF technology and implanted into the uterus of the surrogate. So in this process now, the surrogate is not genetically related to the child because her egg was not used. So the embryo can be created using the intended parent's sperm and egg or that of a donor. But in this case, the egg of the surrogate will not be used. So the surrogate is not genetically related to the child. So this one is, when you look at it, you see that it's a safer process. And this is why it's commonly used. So let's look at why people consider surrogacy. There are things that make people to begin to reason in a particular direction. So before people consider surrogacy, one, infertility must be involved. Like when a woman doesn't have a functional uterus, or a woman whose uterus unsuitable for pregnancy, women that have medical conditions that put them at significant medical risk if they get pregnant, and women that can't carry pregnancy to full term. So these are things that we have under infertility. Then another consideration is same-sex union. We know that for pregnancy to take place, a woman and a man must be in the picture. So when you have same-sex union, like two men or two women coming together to claim husband and wife, definitely they cannot have children by natural process. So most of them resort to surrogacy. Like for instance, gay couple that wish to have children using the sperm of one of the partner or that of a donor. Definitely a man cannot be pregnant. So they'll either use their sperm and get a surrogate that will give them a child or children. Another reason is single parenthood. When a single man wish to have a child using his sperm, without marriage. And these things are becoming too common in our society now, and we're going to talk about the implications. When a single man, we know that children should ideally be raised by a mother and a father. But in a situation whereby a man just wakes up one day and says, man, I'm not interested in marriage, but I want children, the person has no other option than to look for a surrogate, use his sperm, maybe by sexual intercourse or artificial insemination, get the person pregnant, the person borns, and the man takes the child. So another reason is for cosmetic reasons. These days you see women mostly maybe celebrities or stuff like that. They'll be like, they want to marry, they married, but they don't want to experience some pregnancy or childbirth related biological or physical changes. Some of them will say they don't want their breasts to sag. Some will say they don't want their tummy to purge out, and they will just donate their egg. The husband will donate the sperm. They will look for a surrogate and go through that process to have the number of children they have. they need. So the fifth one is societal stigma on childlessness. You know, in our society today, there is a way we see childless couples. We don't actually sometimes we don't look at them with mercy. People will start coming up with so calling name, name callings, like calling them witches, that they are the cause of their problem. Some of these things makes some childless couple to go extra mile just to have children under their roof. So the societal stigmatization can also, make someone to consider surrogacy. So let's look at surrogacy process. Surrogacy is a process. It's not something that you just wake up one day and the next morning you have your child. So it entails a lot. The first is that you have to identify with a surrogacy agency. These days, people are always looking for opportunities to make money. There are agencies, illegal agencies everywhere just for this surrogacy process. So you identify with them, one. Then the agency will help you to search for a surrogate. And the unfortunate thing is that sometimes when they are searching, they will just go to some of these our higher institutions, sell it to them at a very how will I put it? A very pleasing way that when you see it, you won't even think about the negative implications. And they will get name of people, young girls that are interested in this, and they file it. So when you come as an intended parent, what they do is that they bring out their record. Sometimes they have the pictures of some of these young girls that indicated interest in surrogacy. You begin to go through, for you to choose the particular surrogate you want. And there are conditions that they consider, the agency, when they are looking for surrogates. One is that they need healthy women within the ages of 18 to 35. Sometimes they consider people that have had one successful pregnancy is like an added advantage. So it's a sign that everything in your body is working well. And they also consider people that have not had more than 3 cesarean sections, because this surrogacy now is like people are using it to cash out these days. So sometimes you see somebody that have gone for the first one, go for the second one. So these agencies, sometimes they also consider people that have not had more than 3 cesarean sections. And you must be screened, to be sure that you are okay for childbirth. They will check infections like syphilis or hepatitis, HIV and other things, to look out for before they can certify you fit for that purpose. Okay, so the next thing is to schedule a meeting for the parties involved. We've talked about the parties involved in our earlier slides. So now, in that meeting, one is that there must be a clear and open communication between all parties involved. This is what it should be, but sometimes they don't use to communicate openly to the parties involved. The second one is that there must be good understanding of the process involved by the parties. But unfortunately, most times, the agency don't use to explain this process very well to the parties involved, especially to the surrogates. Okay, so the next one is, after this meeting, they will go straight to signing of the legal contracts between the surrogates and the intended couple or individual. Like when I was talking about traditional surrogacy, I said that a lot of things, it entails a lot, that traditional. That is why people don't normally go into that. But even for the other one, the gestational, it entails a lot too. So these days, people do it like a contract. So after the meeting, the next one, because in the meeting, it's assumed that the two parties or all the parties involved have gotten the gist about what the process is all about. So they will go into signing of the legal contract. So in that agreement, one, the surrogate must sign that she is ready to hand over the child to the intended couple or individual after birth. You must sign that. And the surrogate will also attest to the fact that she must not fail in her roles and responsibilities, like attending antenatal care, avoiding alcohol and hard drugs, and also sticking to the advice of the doctors or the fertility specialists that handles her case. So in the contract also, the compensation and payment must be clearly stated. The risk and liabilities associated with the process will be there, and other things deemed fit for the process according to the agency must also be part of the contract. So now we want to look at how profitable surrogacy is. At a glance, surrogacy seems profitable to the parties involved, right? Now, the surrogate gets compensated or feels fulfilled. She gets compensated if she opted for commercial surrogacy, or feels fulfilled, when her rendered, when she must have rendered her, services. Then the intended parent gets their child, which may even be biological. So you see the two parties, when you look at it, you'll be like, man, there's nothing there now, at least I have my child. The other one will say, at least I have my money, things like that. But looking at it deeply, you will see that it's partially exploitative. Yes, I don't want to say it's completely exploitative because I don't have any significant figure to back that up. But I can tell you that the rate of exploitation in surrogacy is very high, especially in countries like Nigeria, where there is no law that regulates surrogacy practice. You can agree with me if you have done things about this surrogacy or you have worked in agencies like that, you know that some of this process, they are designed per agency. The agency designs their own as they want it. And sometimes they take advantage of the vulnerability of some of these younger adults, because yes, somebody may be 18, but the person is still vulnerable. The person doesn't understand some of these things. So it doesn't just stop at saying she's an adult. She's an adult, because most of them, when you want to talk about it, they will say, somebody that is 18, she already knows what she wants. But it's not true. Somebody can even be 30 and still be vulnerable. So both the intended parent and the surrogate are exploited, and the profit earned by commercial agencies or middlemen. When you look at this process now, if they tell you how much they pay and how much they give to those surrogates, some people pay up to like 10 million for this whole process. And sometimes they will just give the surrogate like 1M or 1.5 and share the rest, And sometimes at the end of the process, you will see that, some surrogates are not so fortunate, just to, for the whole thing to end after their delivery. Some people still used to have post-pregnancy issues that before you know it, you will see that the 1.5 million paid to them, they've spent it all and still they will still not be okay. Meanwhile, somebody that doesn't know anything about, somebody that didn't carry the baby, that didn't even do much, will now take the remaining money. So it's very, very exploitative. So in Nigeria, adoption has legislative backing for the Child Rights Act, according to the Child Rights Act 2023, unlike surrogacy. So surrogacy practice in Nigeria is solely dependent on the implementing agency. There is no uniformity at all in practice. Unlike adoption, now adoption is legal. There are, steps to adoption. But in this surrogacy now, there is no step. Somebody can just wake up one morning and say, I did surrogacy. Another person, when you try to interview them, you see that they all followed different routes, which shouldn't be. So some surrogacy agency sometimes give it different name with different explanation just to confuse people and get their buy-in. Even in the religious cycle, you see them even giving example, with biblical backing, like the birth of Ishmael. Some of them will quote Genesis 16:1-4, that when Sarah couldn't birth a child, Sarah permitted Abraham to go and sleep with, things just to confuse the gullible ones from the religious cycle. You don't just quote the Bible, read it down. What happened? Yes, Ishmael was born, but what happened when Isaac was born? How did the family end? What happened? How did Abraham later treat Hagar? Things like that. So you don't just quote Bible because you want to sell your market, which is what some of these agencies normally do. Sometimes they try to confuse people. What they do most times is when they get the intended parents, especially some of them that don't want to be too open, they'll tell them, there's what we'll do to you. You will be pregnant, but the tummy will not be showing. The baby is not in your womb. The baby is in your hips. And they will give them some fertility drugs. And they will start, having symptoms, signs and symptoms of pregnancy, but they are not pregnant. And on the ninth month, the agency will call you to their facility. You will come. They will inject you. You will sleep off. They will just give you a tear in your vagina and stitch it back. And when you wake up, you will see a baby or babies around you. And they will tell you, congratulations. So these are your babies. So the Lord have done it. Things like that. So it's like doing people, the more you look, the less you see. And the worst is that when people get in touch with these agencies, I tell you that no matter how you try to convince them or to open their eyes that all these things are scam, they won't believe you. Some of them will even run away from you or tag you their enemy just because you're trying to open their eyes to the realities on ground. So surrogacy is purely exploitative, especially the way it's being done in Nigeria. So let's look at the implications of surrogacy. We are going to discuss this in 3 categories. We'll talk about the legal, the moral, and the medical implications. Then let's talk about the legal. Surrogacy presents possibilities of trade in babies, financial and emotional exploitation of surrogates. Like normally in Africa, we value children. We don't, I know there are countries or maybe in the Western world, there's a way they, some of them, the way they treat babies, the way they talk about abortion, things like that, that they don't actually have value for the sanctity of life. But when you have processes like this surrogacy that can just commercialize babies, man, come, my dear, I'll give you 5 million, just give birth for me. Things like that. It's like honestly, is trade. There is no other. In fact, I couldn't see any other way to define it except trade. It's just like trading babies. Okay, so we have financial and emotional exploitation of surrogates. Yes, some of these surrogates, like especially in countries like Nigeria, where as little as 1 million matters to people. When you call a young girl now and tell her, just carry a baby for me for 9 months, I'll give you 1 million. The person is not looking at the carrying of the baby for a whole 9 months. The person is looking at the 1 million, So people like that, they are vulnerable and you are exploiting them. You are taking advantage of their vulnerability. And one thing with pregnancy is that, honestly, as in being pregnant without a support is a whole lot. And these are people that will just be pregnant. There will not be any man to assist them. They will just be kept in one place on their own, no emotional support, nothing. It's exploitative. It's not something that we're going to paint, start painting to make it good when it's bad. So the next one is child rights are also called into question in the context of surrogacy, with reference to child's identity and parenthood. Yes. Child's identity. When you have a child, the person the child sees as parents, they are not biologically related to that child. Somebody was telling me, said, Ada, very soon we'll start having what is it called? Citizenship issues in this country. He said the law needs to come out to talk about this surrogacy because very soon, because sometimes people go to far countries, get surrogates there, get sperm donor, get egg donor there. born and bring the children to Nigeria. I tell you that very soon, even those people you call friends that you told these secrets, they will start using it against you. You will see when somebody will stand up to contest the election and say, no, don't mind this one, no. There is no Nigerian blood in this one. The egg is from China. The sperm is from India. The mother that gave the surrogate is from Japan. Things like that. And once they prove it and all these things are true, it can affect the person's chance. So we have problem with child's identity and parenthood here. That is it. And I want to talk about that citizenship. The person said it, and honestly, it makes sense. So, because if we are not careful, this whole surrogacy issue will start, bringing issues with citizenship, and it may not augur well with us as individuals or as a nation. Then for the moral aspect of it, surrogacy practice poses a threat to the holy institution of marriage. Honestly, with surrogacy, what it means is that anybody can have a child. And one of the reasons why we marry is for procreation. So if children can actually come outside marriage and people see it as a normal, take for instance, when a young man says, man, I am not ready for women affairs. I don't want marriage. Let me just have a surrogate to give birth to me with my own sperm, things like that. So very soon you will see people will start, seeing marriage as a trash. Since they can have children, they can get the benefits of marriage without marriage. So it's a threat to marriage. Then it's also a threat to the dignity of reproduction or procreation. Procreation is something that is sacred. That is why when a woman gives birth, there is this joy that comes within. Everybody is happy because another life is born. Okay. And I can remember in the olden days, when you see children born out of wedlock, it's like when people see them, there's this, there's this pity. Or when you hear that, that 16-year-old girl, she didn't marry or she gave birth, that joy will not be complete. She gave birth, yes, but the circumstance surrounding the birth is what, makes you somehow to feel somehow or to frown your face. So we don't want, children to be treated that way. Because the truth is that the circumstances surrounding a child's birth affects the child as an individual. That is why sometimes when you go to the hospital, if your child is sick, when you go to the hospital, the doctors will try to find out the circumstances surrounding that child's birth. Because there are circumstances that surrounds a childbirth and will be affecting the child health-wise, psychological-wise, and every other aspect of that child. And children are gifts from God. We don't want, things like commercializing them, getting children anyhow, we don't want it. It will not be good for us as parents or as young ones. So this issue now with surrogacy, anybody can have a child. Please, it's not ideal. It's not ideal. Children are not meant just for anybody. I said anybody, that is why it is a gift from God. Whoever God deems fit to have, God will give. So let's also talk about the disruption in family unity and trust. I know of a woman that she couldn't give birth. She went and brought one young girl, and sometimes this childlessness affects us women more. The husband was angry. The husband said, no, forget it. We've been happy without children. The woman said, no. I don't want to lose it. Things like that. And finally, the man had an affair with the lady and got her pregnant. And before you know it, the affair continued. You understand? The man couldn't stop it again. And before you know it, the family scattered. It affected their unity. But this was a family that they used to live very well. So this process can also affect family unity and trust. And not only in the case of sexual intercourse, sometimes when the children are born, normally there are ways that children behave that can get parents angry. But when you remember, man, this one is my blood. In fact, sometimes I used to tell parents that some of these things children do were what we did when we were small. So when
Like
you have
really
that
small.
mindset, you see that no matter what they do, you will find a way to just forgive them. But sometimes when people bring all children from surrogates, you will see that they may not be patient enough to tolerate all the little bad behaviors that may come from that child as a child. And it can affect family unity and trust. So it can negatively affect parent-child relationship when the child gets to know the method of his or her birth. Because most times, even my 7-year-old son, one day, I don't know what they discussed in school, he came back and said, "Mommy, how did you born me?" So I started explaining. So in this place now, I want us to ask ourselves, adopting a child and having a child by surrogacy, which one do you think is easier to communicate to a child when a child asks questions like that? Then another thing is that it affects the surrogate's privacy over her body when carrying the child. When the surrogate is carrying the child, she has been paid, and the intended parents have access to her privacy anytime. They can just come in and say, they want to know the position of the baby, and they will go for scan. They want to know how the baby is faring. They just want to see if the baby is okay, sometimes even against the surrogate's will. But she don't have any other option than to submit to their request, because she has already been paid for that. Then another is that surrogacy is not in good standing with our African culture. Some of these things we are borrowed, and honestly, it doesn't really augur well with us as Africans. Then for the medical aspects of it, the process of ART may affect embryo quality, thereby increasing the chances of the child being born with abnormalities. If more than one embryo is transferred, it will increase the risk of multiple births, which is usually associated with premature births, low birth weight, and other health complications for the baby. For the egg provider, fertility drugs, which are normally given to stimulate the ovaries to produce multiple eggs, can cause rare cases, like blood clots, kidney failures, which may even lead to death. So for the surrogates, pregnancy and birth are associated with many risks like gestational diabetes, high blood pressure, bleeding, even the risk of cesarean sections, and some of these risks can affect the woman's delivery in the future, especially if you are young. If you are young and you have done like two surrogacy with cesarean section, definitely you will know that even when you give birth, the chances of you giving birth by cesarean section increases, and it may affect the number of children that you can give birth to. Then we know that surrogates, most of the time, they don't usually breastfeed their babies when they deliver, and it can increase the surrogate's chances of having breast cancer. Then mental health issue, during pregnancy, there's usually a lot of bonding between the surrogate and the fetus, So when they now finally give birth and the child is taken from them, most times the surrogates normally slide into depression, and have other mental health issues. So for the conclusion, I'm of the opinion that if surrogacy is not well regulated in Nigeria, it could expose the younger ones, who are mostly used as surrogates, to greater reproductive health chances. And another one is that younger women are mostly encouraged to shun idleness and get rich quick syndrome. When you are getting your little money, even as a young person, there are skills that you can get involved into that will be giving you small money. So when you are financially empowered, it affects it can help you to make informed decision, improve your negotiation skills and refusal, skills. Thank you very much.
Thank you, Ms. Adobe, for doing justice to the topic. I now invite Dr. Achebe to speak to us on the topic, egg donation. Dr. Francis Achebe. Dr. Achebe will be speaking to us now. Dr. Francis Achebe, are you there? He told me his network is really disturbing. Mr. Adobe, please could you share from your own side the slides on egg donation sent by Sister Priska?
Achebe is not here. I hope it's all is well. Frank is not here.
Okay, he sent you a message that his network is really
Okay.
disturbing.
Okay.
Mr. Adobe, please, from your own side, could you share the slide on egg donation?
Sorry, Father, I didn't get that slide though.
Okay,
She
all
didn't.
right. I'm going to
Yes.
present it without the sharing. Then after the presentation, I will send it across, please. I have the slides here. I'm going to very quickly. We have a discussion on egg donation. This is the presentation from Sister Priska. Sister Priska couldn't join us now because she is on transit, but she has already sent her slides. A woman donates her eggs to another woman. Talking about what egg donation is. That is a practice whereby a woman donates her eggs to another woman to help her have a baby. In a normal cycle, only one egg matures and is released during ovulation. Hormonal treatment therefore causes the maturation of several developing eggs. And this can be done by the donor who is, simultaneously. This can be done when the donor releases her eggs simultaneously within 12 days. Every cycle, several eggs develop, but only one of them matures while the other disintegrates. But for this process, all the oocytes that develops are stimulated to mature without degenerating so that more than one mature egg is harvested. Sperms are then placed around the ovaries or each sperm injected into each ovary to cause fertilization. Then what are the indications for egg donation? One is poor quality oocytes, that is developing eggs, advanced maternal age, women who have experienced recurrent in IVF failures may also consider the option of embryo donation, the option of egg donation. Couples with genetic diseases or chromosomal abnormalities not willing to pass on to their children. Women born without ovaries, women or lesbian couples who may choose to have families of their own, to adopt a child, those placed at a low priority by adoption agencies, and also those who may not find a stable infant to adopt. Then male factors for infertility. We now talk about recruitment for business. In the presentation of Sister Priska, she has this slide that talks about business. Many people are using egg donation as a means for business. And we see that in Nigeria often. I had a discussion in the Catholic Singles WhatsApp group. I was asking them about this egg donation. Have they heard about it? What do they have to say? Someone responded that, of course, that she knows a young lady who sold her eggs for how much? Either for 50,000 or 60,000 or thereabouts. And yesterday, I had a discussion with a young lady from Kenya, from Nairobi. I hope she's in this discussion, in this conference right now. She told me that in her country, she actually encountered a young lady who, Some people were telling her about this business of selling of eggs, of donating eggs, and trying to convince her. For her, it is something that is common where she comes from. For some people, they use it as a way to make money, you know. Physical attraction, intelligence are a selling point, especially for owners of fertility. Very commercialized. The higher the threat, the higher the price, the more attractive to donors. Yes, Sister Priska is saying that the higher the threat, there are some eggs, that are more viable than others. Those ones are being sold with a higher amount of money. And that's business for those who are into the business. We now talk about Nigerian egg business, a donor's testimony. Someone said that she complained about her predicament to a friend who is a medical student. The friend suggested that she should donate her eggs at a fertility clinic at the rate of 80,000 naira, which is 195 US dollars, and 150,000 naira, about 365 US dollars per cycle for egg donation. You see, it is really a business. Another person said that it is better for her to donate her eggs than enter into prostitution. Rather than being a prostitute, she prefers to sell her eggs. A 26-year-old baker who sells cakes and pastries from her home in Lagos has donated her eggs 6 times since February 2020, even though experts like the American Society for Reproductive Medicine recommend that women should only donate their eggs 6 times in a lifetime. This 26-year-old baker donated her own 6 times since 2022. That's from 2020 till 2024. She has donated her eggs 6 times. This is really alarming. It calls for, serious concern. If I bring somebody and they donate successfully, according to the person, she gets some money, 20,000 naira each. She has referred 3 people like that, and now she has received 60,000 naira. That is free money, she says. When somebody refers someone to donate egg, the person referring gets a commission. That is really business. That's the society where we are. It is really alarming. Now, let's talk about the ethical or legal issues associated with that. One of them is the missed embryos. For more than one donor to increases the chances of identity crisis without DNA. Eggs becomes commodities. The next one is that there is a reduced consent of exploitation leading to modification. Whereas sharing becomes charitable, donor anonymity, and many of that. I'm going to stop this presentation here. I want this to be interactive, looking at some points raised in the slides of Sister Priska, especially the business aspect of it, and the presentation of surrogacy, which was presented by Mrs. Adobe. I now open the floor for us to discuss, ask questions, and comment on this. I'm going to share the slides later. Dr. Francis, are you back? Okay, now it's time for question, comments, contribution based on these 2 topics that we have presented. If you want to ask a question, please raise your hand up. Then if you want to make a comment or a contribution, raise your hand up. I can see Dr. M.O.D. Aboni. Doctor, let's begin from your own side. What comment contribution do you have to make, Dr. Aboni, especially on the aspect of egg donation?
Okay, Father, good evening. Happy Easter in arrears. Father, can you hear me?
Perfectly well.
Okay. I wanted to thank Ada for the lecture. There's an aspect which has been confusing me, which she cleared, like was it that pregnancy she talked about that day? Because I've been hearing that thing, and I really don't understand how the thing works. And now she has cleared my ignorance, especially the aspect of pumping them with hormones. And when the time reaches, they would put them to sleep and bring in false babies. Because I've had the experience of even a woman bringing in the mother, that the mother is coming in for Mugo. While we did a scan and the uterus was empty, and I was like, what type of madness is this? Today, I've known how it is done, and I appreciate it. Thank you, sister, for that aspect. Then the aspect of egg donation is really a very tall order. First, is a very highly scientific project, and so anybody who undertakes it too frequently runs a risk of damaging things in her body. Of course, like sister said, the natural thing always comes best. But in a situation in Africa where we are, parents, couples are under very severe stress to have babies. Indeed, if you have only one sex, is a problem, not to talk of when you don't have at all.
Dr.
So,
Boni, are you there?
yes, a call just came in and caught me. I've deleted it. So, if a couple wants
Dr. Boni, are you there? Okay.
Sorry, this call, please. Please.
We can't hear you, Dr. Boni. Are you still there?
I am not. I had to. I was saying that at that started in a lecture like this, you probably would have just give the lecture and your opinions on what. However, I think that it's a couple like this other one that the man going for surrogacy. I'm opposed. It's a sin against. However, if a couple is having
Dr. Boni, your network is bad. It's breaking. Maybe you could send it on chat. Let's read it out. It's breaking.
Thank you so much.
Thank you, doctor. It's breaking. All right. Dr. Francis, are you ready for your contribution? Okay,
Yes,
Vivian is
I'm
also...
having, but are you hearing me now?
Yeah, we can hear you. It's better now.
Okay, let me quickly make my contribution. My contribution is on some of the problems that egg donors may have. The first is that they are prone to having adhesions or scar tissue that forms in their pelvic region as a result of the egg retrieval procedures. Now, this can result to chronic pelvic pain and distortion also of the anatomy of the pelvic organs. In long run, adhesions that are not properly taken care of can affect the fertility of those donors in future. Adhesions can affect the movement of the fallopian tubes. Adhesions can cover the surface of their ovary and reduce their chance of getting their own children. Because each time those egg retrieval is done by the instrument that is passed in their body to proc on the ovary, it creates a scar which doesn't heal naturally. But if a woman ovulates, she will have what they call the ovulation stigma, which heals within 24 to 48 hours. But in this case, the kind of ovulation they are having, we can call it iatrogenic ovulation. That is, ovulation induced by medical intervention. We did not give them medication to ovulate. Rather, what we did was to pass instruments to pierce through the ovarian capsule to suck their follicles. It's as if the woman is having some repeat series of ovarian drilling, kind of, because the instrument goes into the ovaries, suck the follicles, and then it can be multiple locations before they could get what they want. At the end, they are prone to adhesions, scar tissue formation, resulting in pelvic organ distortion, and this can affect their own fertility in the future. There is a publication in Autopsy Case Report 2022, where there was a case of a sudden death of a 35-year-old girl from egg donor during the process of egg retrieval. This resulted because she had ovarian hyperstimulation syndrome. In that reported case, she actually died. Now, also infections, pelvic infections can take place because of repeated passing foreign instrument into the pelvis of the woman. She's at risk of pelvic infection, which may compromise again her own fertility. Some of them have heavy vaginal bleeding after the procedure. Although they will be given some medications to handle, or they have to be changing their pad, but this bleeding in some cases could be so serious that they may need blood transfusion. But I know that some centers, before they can get somebody to be an egg donor, they may have checked the person bleeding profile and clotting profile and all that. But these bleeding complications do arise sometimes. Pelvic abscesses can also form. It is very rare, but it's a recognized complication from oocyte retrieval. It is said to occur in less than 1%, but it does occur. Now, this is what the IVF center said. I'm reading exactly their word. They said, during egg collection, we suck the fluid out of the follicle. The fluid contains granulocyte cells, and they are the ones that produce the hormones. So, by stripping the follicles out, we reduce their ability to produce enough progesterone in the luteal phase to support the pregnancy. So egg donors, anytime they are giving medication to stimulate them for follicles to be harvested from them, they end up to be in a state of progesterone deficiency. This can expose them to premenstrual syndrome. This progesterone deficiency repeatedly, depending on how frequent this lady goes for egg donation, could affect her own fertility itself, because studies have shown that progesterone deficiency can actually be a cause of infertility. But you know, she won't know she's entering infertility at this stage of egg donor, since she's donating the egg to somebody else. It is when she now wants to ovulate by herself that she may have issue. Now, feeling of emotional challenge during egg donor, they said is normal. So psychologists should be handy to assist. Okay, and there's other points that it will be good for us to know. There can be loss of both ovaries. There can be loss of one ovary or both ovaries as a result of egg donation. Like I mentioned before, when these follicles are being harvested, if it's not done well, there may be bleeding, and this bleeding can be so much that it will compromise that ovarian function itself. And there are reports that people have lost one or both ovaries after egg donation. These are the things that can happen to egg donors. They may not know until when it's time for them to want to have their own fertility. There is also the issue of sometimes high blood pressure and preeclampsia and preterm birth. It's now being reported that people that are egg donors previously, when eventually they achieve their own pregnancy, they are exposed to high blood pressure in their pregnancy and preeclampsia and preterm birth and low birth weight and a high risk of them having cesarean section. We don't know why this is happening, but it's now being observed because some people have successfully donated eggs and later got married and started having pregnancy. So, you know, in countries where data are kept, they are now finding that those that are previous egg donors have risk of high blood pressure in their existing pregnancy, preeclampsia, preterm birth, low birth weight, and sometimes even high risk of cesarean sections. So the other thing I want to just contribute is on the surrogates that I didn't hear it mentioned. I hope I'm still being heard.
Yes.
Now, when a surrogate accepts to hold a pregnancy, that surrogate did not ovulate. The natural event is that when a woman ovulates, she gets fertilized and baby stays in her womb. After the ovulation, the corpus luteum in her ovary, NAPRO technology study have shown that corpus luteum actually do not disintegrate. That corpus luteum stays active till term. It has been already published that the corpus luteum in a pregnant woman stays active till term. Even though placenta makes progesterone, that corpus luteum in her ovary still makes progesterone. So now that is a natural way. Now in a surrogate that is carrying a pregnancy, she doesn't have a corpus luteum. The consequence of that is she would depend only on the progesterone made by the pregnancy to sustain that pregnancy. That is why in many cases, many times, surrogates end up with miscarriage. Because if the progesterone is not adequate from that placenta, and there is no investigation to check the progesterone to get a proper replacement, they will miscarry that pregnancy. And the feeling of loss is there for even that surrogate, because the surrogate did not want to miscarry the pregnancy. They want to carry the pregnancy to term. But because that pregnancy they are carrying is abnormal in the sense that there is no corpus luteum in her ovary, she will only depend on the placenta when it's developed to supply enough progesterone to sustain that pregnancy. And if there is no adequate progesterone care, that pregnancy will be lost. And sometimes, even if it's not lost, they will end up having a premature delivery. So the absence of corpus luteum in a surrogate is a pathology. And it's iatrogenic. We created it by ourselves because she did not ovulate. So it's even not a normal process. It's not a normal process on its own. It's a pathology. A woman is pregnant, but when you scan her ovaries, you won't see the corpus luteum because she did not ovulate. This happens not only in surrogate, but also in women that are in marriage and went for embryo transfer, embryo donor. You know, they did not ovulate. They bought egg from outside. They got the sperm from outside. They got fertilized and they implant the embryo into her. That woman will not have a corpus luteum. It's the same situation that will go in. No corpus luteum to assist in sustaining the pregnancy as is done in nature. And I'm just repeating that the corpus luteum of pregnancy does not disintegrate. It stays on till term. Studies have been done in NAPRO technology and has been published. What we know before, they say, okay, when placenta is established, the corpus luteum will disintegrate. It's not so. The corpus luteum stays active. If it disintegrates, it's actually a pathology. Because what sustains the corpus luteum is the HCG of pregnancy. And as long as the HCG of pregnancy is being produced, the corpus luteum will be active. But if the HCG of pregnancy is inadequate, the corpus luteum, the only thing that sustains is the HCG, it will disintegrate. That on its own is a pathology. So we are looking at these issues from this angle in terms of the surrogate, that pregnancy is not normal. because she did not ovulate. The same will be for a woman that is in marriage and choose to take embryo transfer where she did not ovulate. She will not have corpusculum in her both ovaries at any time when she undergoes ultrasound. All right. I'm happy that I'm able to say all these things before my network starts acting.
Thank you so much, Dr. Francis. We appreciate you. Now, this is the time for contribution, comments, intervention. You can decide to put it on the chat and read it out. You can also decide to raise your hands while I invite you to speak. I now call on Vivian Chisom. She has been raising her hands. Vivian. Chisom.
Hello.
We can hear you.
Okay. Good evening, Father. Good evening, everyone. Okay.
Good evening.
I want to ask a question. So my question is, how is surrogacy a sin against God? For instance, let's say that there is this couple that they cannot conceive, and someone volunteered to be their surrogate. Is it a sin against God to try to help somebody to have a child?
Let me respond to that quickly. The ethical or moral issue, let me say the religious issue of surrogacy in line with the teachings of the church is this, that when it comes to fertilization, God has made it in a way that there is a fertilization that occurs between egg and the sperm. Fertilization is something that is supposed to take place within marriage. That is sexual intercourse within marriage. Now, in the case of surrogacy, there is that disconnection between what we call the unitive purpose of sexual relation. Any fertilization that takes place outside the context of marriage, that becomes an issue in itself. So why do we now say that surrogacy is contrary to God's purpose of sexuality? Is because a sperm of a man, and the egg of another person, the egg of somebody who is not even his own wife, there is that fertilization, and now another person now bears the embryo. That becomes something that is foreign to church's understanding, to Christian understanding of, fertilization. That this moral issue, when you look at it in the context of marriage, you will see where the issue lies. But somebody who wants to, a couple that is in need of a child, what can you do? The church does not advocate for surrogacy. The church says that, adoption can be an option. Adoption can be an option. In the case whereby maybe the person doesn't want adoption because of maybe the person wants his own blood or whatever, then those in technology can also come into the aspect. But to say, let us go for surrogacy, that is foreign. That is contrary to the understand the unity and procreative purpose of marriage. So that is the line. So it is from this context of the unitive and procreative purpose of sexuality that we come from that angle that no, surrogacy is not an option. Vivian Chisobili.
Yes, Father.
So if you want to be charitable to somebody, being charitable is not for you as a young lady to say, okay, let me now carry this embryo for the purpose of, to help this couple, this childless couple. No, that is not charity in that sense because of its ethical issue. Okay?
Okay, Father. Thank you so much.
It's now late for us to discuss, to make our comments and contribution on this before we end. Today, I invited someone for this program. The person told me that she has been planning to do surrogacy. So coming for this program, she has already planned to do surrogacy. So hearing this program, she knows that in this program, we talk about the issues with surrogacy, and she's not happy. She's not happy. So for those who ask that, what is the church doing to help couples who are in need of children? Now, why is the church not allowing surrogacy? Why is the church not allowing IVF? Why is the church not? The church is not here to add more miseries to childless couples. No. Rather, the church understands their situation. So any means of fertilization, means of reproduction that in a way goes contrary to the idea of marriage, that goes contrary to the idea of having children, the church will say no, there are better options. Let's look at these options. And that's why we have those in Apple technology coming up with, you know, advanced technologies that can help childless couples to have children, not through IVF, not through surrogacy, and all of that. But just know that the church does not add miseries to those who are childless. Rather, the church is there to support, is there to be a mother, and is ready to offer necessary support to help them overcome the challenges they have. I just want to make this point. We have Olorobota. Please unmute yourself.
Good evening, Father. Good evening, everyone.
Good evening.
Okay, so my question is not exactly about any relation, but something that
Please,
relates to relationships.
there is background noise where you are. There is a background noise. Your network is breaking. Maybe you can put it on the chat. We read it out. It's breaking.
Oh, okay.
Yeah, it's breaking. You can put it on the chat. I will read it out if your network is not good. Or you can try once again. Let's see if it's okay. You can try once again. Let's see if it's okay. Okay. In the chat, we have a question. Someone asks, how can a child born through surrogacy have an identity issue more than an adopted child? Mrs. Adobe, this question is for you. How can a child born through surrogacy have an identity issue more than an adopted child?
Okay, thank you very much, Father. Like I said before, in Nigeria, we have a legislative backing to adoption, but we don't have that for surrogacy. Okay, I know that before the enactment of the Child Rights Acts of 2003, different states in Nigeria had their different process of adoption. Even up to date, I work in Enugu, and I know that every adoption process in Enugu State starts with the Ministry of Gender. Okay, so we have a legislative backing. We have like a detailed process for adoption. Unlike surrogacy, surrogacy is something that people can just wake up. It's exploitative. You know, there are so many people that will go to the village, pack girls, keep them somewhere, and just be using them as surrogates. Okay, and when you born children like that, because there is no there is no legislative backing to the process, the way you got the child, anything can come up. That is what we are saying. What I mean by the identity issue is that in the nearest future, any issue can just come up with the identity of that child because there is no legislative backing to the process of the child's birth. But unlike adoption, the two processes are almost the same, but adoption has a legislative backing in Nigeria. Thank you.
Thank you. But the question is, how can a child born through surrogacy have an identity issue more than adopted child? Not about being legally accepted in the country. Mr. Adobe.
Yes, hello, Father.
Father, can I have answer that question?
All right, go ahead, Dr. Francis.
Okay, you see, the child here, I understand this person's question very well. He's talking about identity issue. Now, let us take the adoption. When a couple decide to have an adoption, like our presenter had told us, they will pass through a legal process. When this child gets to 18 or 19 years, the parents can actually sit the child down in their house and let the child know we don't have children of our own, and we went and got adoption. That is how you came into our marriage. And the child will ever be grateful to them that he was adopted because the child was informed. It's clear. Now, in terms of surrogates, if a child is born through surrogacy, when will the parents ever tell that child? Will they ever do it? Would they ever say, look, we couldn't have children of our own? Then Auntie XYZ now accepted to carry a pregnancy. Then we didn't even have good egg. We didn't even have good sperm. So we bought egg, we bought sperm, and then put it in the womb of Auntie XYZ. Then that is good. Can any family be courageous enough to tell the child? So the child was not told. As this child is now growing in this family, issues can come up. Issues of blood transfusion, issues of genetics, and the child will find out that his gene doesn't match the family. But the adopted child, if he finds out that his gene doesn't match the family have already told him or her that you are adopted, and this is your adopting document, and the child will be grateful to them that they gave him life or they give her life. But for the surrogate child, will any parents ever pick the courage to tell a surrogate child how the child came about? They will not. They will hide it from the child. And no matter how much you hide it, something will happen that will make that information necessary. And the family will disintegrate. That is the identity crisis issue. But there will not be identity crisis issue. And the child will accept the family that have adopted him or her, but not for surrogates. The surrogate, probably you tell the child that even the person that became your surrogate is not even our relative. It's one girl that came and we paid her. Where is she now? We don't know. Then the child will go further to now find out that even his genes does not match the same people that claim that they got a surrogate to have a child. That will tear that family into pieces. That is the identity crisis.
Thank you. Thank you, Doctor. Mrs. Honorable, you are still raising hands. Do you still want to speak?
Can you hear me now?
Better, okay.
Eggs. Some
Please, we can't hear you. The network is still bad. Just put it on the chat. I'm sorry. I'm sorry. The network is bad. Put it on the chat. I will read it out. There is a question that says, in what aspects does the church support childless couples? Yeah, first and foremost, the church supports childless couples through pastoral care. What do I mean by pastoral care? First and foremost is through prayers. Okay, the church always have in mind the issue, the problems that many married couples experience. The church follows it up through prayers, through support, by being close, and again, through the services of Catholic medical doctors, through the service of Catholic medical doctors, through the service of Catholic hospitals, Catholic fertility centers, Catholic fertility centers, and also through different groups, associations in church. There are parishes that have groups that focus more on those that experience issues with regards to childlessness. Okay, so these are the various ways, especially the medical service. And the church encourages Catholic doctors to do more research that can be of great benefits to childless couples. Just like what Dr. Francis Achebe told us in one of our conferences about Apple technology. The church encourages that for those who ask what is the option, the church is against IVF, the church is against surrogacy, what is the option? We are happy to hear about Apple technology. Apple technology becomes an option too. Okay, so these are also the various ways the church assists childless couples. What of in the case of IVF, where the egg and sperm are that of the husband and the wife? This question is about IVF, okay? We talked about IVF in one of our conferences. Here, we are not talking about IVF, we are talking about surrogacy. IVF has its own moral issues. One of the moral issues with IVF, is the frozen of the embryo, discarding the embryo, which has the same moral implication with abortion and all of that. So this question that what of the case in the case where the egg and sperm are thought of the husband and wife, now the embryo will now be carried by another woman. A third party is now involved in that marriage. Okay, which is not the ideal. Whether the egg and sperm are from the couple, provided that there is a third party, someone else who is not carrying it, that becomes an issue itself. There is a question that is being asked. In this case, when the baby is born, who is actually the mother? Here we have the biological mother and we have the genetical mother, or what else? The child having two mothers, the genetical mother, the biological mother. That becomes an identity crisis, okay, in the life of the child. That is not the best way to go about it. Okay, any other question on the chat? No other question. Okay, if there is no other question, we come. Isn't it God that gave man this wisdom? How can God reveal a wisdom that is against him? God gave man wisdom to do surrogacy and the IVF and all of that. Please, just so bear in mind that there are some science. The church is not against science. The church is neither against technology, but any science or technology that goes contrary to the idea of life, to the idea of faith, that is where the church comes against it. There are people that use the wisdom given to them by God to solve problems in a way that goes contrary, that has moral issues, ethical issues. For example, abortion. You could ask that, is it not God that gave the medical doctor the wisdom to do abortion? Doctors who do abortion, who gave them the wisdom? So any medical discovery or anything that goes contrary to the idea of life or that has moral issue, that goes contrary to what we believe as with regards to life, with regards to fertilization, with regards to marriage, of course, that is not to be accepted. One can use the wisdom to invent something that goes contrary to the faith. So here we are not talking about the wisdom now, rather we are talking about the implication. What is the moral implication of surrogacy? What's the moral implication of egg donation? Is it really solving problem or is it causing problem more? That is what we are talking about. And we see that in egg donation. It is common, okay? It is not really solving problem as we have seen from the presentations. Someone told me this evening that one of the reasons why young ladies sell their eggs is because of poverty. They just want to make money. Imagine a girl who hasn't seen money to feed. Maybe she's in school and someone told her that if you sell your egg, you earn 50,000 or 100,000. Okay? So she will go and do it. She will go and do it because of poverty and many of that. All right, let me leave it at this point. We are about to end the conference now. Maybe one intervention, if someone wants to make any intervention, final intervention, you have the opportunity to do that. Otherwise, we come to the end of the program. Father, please, I want you to also address the fact that some couples aren't sincere in their narrative of childlessness. A woman will come to you and ask you for prayers, whereas the woman has no womb. She must have lost it maybe through several abortions in the past, but they won't open up either to the husband or to the priest when she asks for prayers. Thank you for bringing this up. That is the reality. The person that sent this, thank you for bringing it up. That is the reality. Imagine a lady who has done several abortions and we come to me as a priest or come for a prayer or, asking God for miracle. But inside her, she knows that she doesn't have womb. She doesn't have womb. Rather than the person to come up to say the truth, let's hear the whole story. Rather than this is self-deception. And the Bible says that nobody can make fool of God. The person is trying to make fool of God. Nobody can make fool of God, you know. And the lady who enters into marriage with this kind of deception contracts invalid marriage because here there is deception, okay? You do not have womb, you hid it from your spouse, you enter into marriage, only later for the man to discover that you never had womb. You have deceived him. And that marriage can be annulled based on that because of the deception of consent. Thank you for bringing that up. This is for all ladies here. Try to open up before you enter into marriage. And the final advice for ladies here is that be contented with what you have. Do not let anyone lead you into this evil practice of selling your eggs or doing surrogacy or that. Don't let poverty, don't let advice from friends or the influence of the society where you live push you into this practice. You have known the moral implication and you know that it is contrary to what we believe as Catholics, as Christians. Okay. Mrs. Choma Ihejua, final words.
I don't know if I'm...
Unmute yourself, please. Mrs. Choma Ihejua.
I said my question goes to the surrogacy. Now, in the process, someone, the domestic aspect of it, the reason why the does not work.
Your network is bad. Your network is bad.
You can't
Be audible.
Okay.
I think it's better now.
Someone does not want to carry the baby. That is on the is it the genetic aspect of it, the implication of the reason don't want to carry it.
Mrs. Choma, please put it on the chat. Yeah? Your network is not good. Put it on the chat. Let's read it out. Thank you.
All right, Padre, am I allowed to go on, please?
Please go on. God bless you.
Good evening, everyone. I've been trying to get our attention. My question goes to the speaker on surrogacy, and I have a few questions and maybe more. I'll need some elaboration. Actually, I was following Accumulate anyway, and I tried to pick up one or two things he was saying. And actually, I was looking at life is all about making our life here and people that will come after us better. And if by any means, me as a person, and maybe my wife couldn't, give birth due to one issue or the other, and we decided to go for surrogacy, I'm thinking I'm not deceiving the next one if I'm able to open up myself and see the issue, we can't have baby and we need to do this for us. And in my own thinking, I also think that if we have a legal back into this, instead of trying to shy away from it, because definitely things are changing. I've seen a 23 or so year old girl have big myoma, and after the surgery, it's affected the endometrium, and of course, we know what that one ends with. And now, this girl didn't do anything bad and probably gets married tomorrow and cannot conceive. And why would the church dissuade such couples from seeking help from the next person? If all of us, when we develop kidney problems, we also seek out to get a donor, most of us go for liver or whatever transplant. These things are gotten from another human like us into us. Now, why should the church dissuade people from going into surrogacy if we can champion and get a legal back into it? Also, it talks about exploitation, that some we have been exploited. And I can put it to you that there's some people in the villages that still practice the adoption she talked about without following the legal ways. Okay? But if instead of shying away from this, instead of trying to dissuade everybody that this is evil, this or that, if we can get the government to have a legal way to do this, if you need this, there's an agency or a committee that will handle this. And you go through that process and have your baby, you can be a biological mother and also be a foster mother. When the child is born, the child is being named. When he's up to 18, you explain to him or her. Because when you talk about identity crisis, I'm sure most of us still grew up with that, even though we know our biological mothers. Because as we are, none of us know how we are born. We are told we are born. When we got to age, we realized that this is our mother and started calling her mother. And some people, the same way they grew up with somebody, and when they grew up and they told them you are a mate to these people and your actual mother is also place, it doesn't take the fact that some of this child still take care of their biological mother and also take care of their foster mother. I also quickly want to talk about, she made mention of risk of cesarean section. And the last time I checked, is not a bad thing and a bad thing to go through CS, whether in a surrogacy or a normal pregnancy. Once in a pregnancy, the baby is delivered, is seen as a normal pregnancy, whether by V delivery or by C-section. And also, he talked about it affects embryo and cultural thing is now a culture. And the last time I checked, our culture evolves. Most of the things we do today wasn't the way they are done last 50, 30 years ago. If last 30, 40 years ago, our fathers married multiple women, and today we are having one, that means there is culture change. So this aspect of is not our culture to get someone to get, I don't think it really go well, because for the reasons I've already said. And these are the few questions I have for her. And I think when we're talking about egg donation, I also jotted out some things, but I don't know. I would like her to respond to this if I proceed. Thank you.
Before I add my voice to this, Mr. Adobe, do you have something to respond to that, or should I go ahead?
Okay, thank you, Father. I actually didn't get some of his concerns and questions, but the first one I want to say is that this seminar is designed for singles, and our objective is to let them know, because singles are definitely people that have not married, they've not given birth. So we want to let them know some of the things that surrogacy can, prevent them from achieving finally when they get married. So when I talked about cesarean sections, there is nothing wrong with cesarean section. I gave birth to all my children by a cesarean section. So I am not against that. But what everybody should know is that to a reasonable extent, cesarean section sort of limits the number of children that somebody will have if you are going by that, delivery pattern. You understand? So you can't be doing as a medically, I am not talking from the spiritual aspect of it. You can't do cesarean section for it's not normally advisable to do it more than 4 to 5 times. Okay, so if, for instance, now a young girl started on the path of surrogacy and maybe I've done surrogacy for 2 to 3 times and delivered by cesarean section, definitely when the person gets married, it's definitely going to affect the number of more delivery that the person will have. So that is what I mean by that aspect. So this workshop is for singles. So we are trying to, to discourage them from, sometimes, single girls, single guys, we feel like we have our time. I can do whatever I want with my life now. But finally, when they get married, just like the person that talked about somebody without a womb, you can imagine that then this person have done a series of things in the past and that affected the womb. And when she noticed that, what will she do? She will now fall back and go and meet innocent children for the surrogacy. You understand? And the cycle of infertility will continue. That same innocent child may, in the process of the surrogacy, have another issue that will affect her when she finally gets married. Her own infertility will start and she will look for another surrogate. Things like that. So these are some of the things we are trying to discourage people from doing. Then you talked about kidney donor and, there is nothing wrong with somebody donating the uterus and stuff like that. Please, remember, a child is involved. Okay, a child is involved. So that is the aspect I am looking at it from. It's not like kidney, when you're talking about kidney donor, is adult to adult. But this one, just like Dr. Achabe said, that identity issue now, when that child, some people may not even be fortunate enough to know about their case at 18. These days, people can even throw it to you. See this one, you think these people are, and that child from that tender age, maybe 10, 11 years, will start having issues with his or her psychology. Okay, so a child is involved. We don't want, a case whereby children would just be commercialized, or somebody now, a single guy, you can say, I don't want to marry, but I want to have children. Or gay couple will say, we want to have children. Okay, now a child born to gay couple, what do you expect? Is it not surrogacy? What do you expect? So that cycle of homosexuality will do what? We continue. So these are some of the things we are, trying to discourage. We have children everywhere up for adoption, children that were orphaned, that needs to be trained. So we are not, the church is not saying, is not closing her eyes, to childless couples. No, but we are saying that since we have all these children, some of them were orphaned, some of them were picked from the streets, some of them were abandoned. Let us join hands to adopt them and train them, have them as our own, than going to, get headache. If you have gone through this process of, I have seen, people in schools that have gone for surrogacy, and I can tell you that more than half of them, are not really happy with the process finally when you get it. So we are trying to open our eyes that it's not as sweet as it sounds. Thank you.
Thank you. Just to add to my voice to why is the church against it? I think I have responded to that in the few questions raised before. I began by saying, first and foremost, that the church is close to childless couples. The church does not close her eyes to the suffering of childless couples. The church is not against surrogacy because she wants childless couples to suffer or for their parents to increase. No. But it is because of the dignity of procreation. Dignity of procreation. God is the giver of child. God is the giver of child. Okay. Now, husband and wife, through the act of procreation, operates in this creative work of God. It is God who brings child into the world. That has been the faith of the church. Procreation is something that has dignity, and the dignity of procreation takes place within the context of marriage. And when we talk about sexual act, marital sex, it has the unity purpose, it has procreative purpose. In surrogacy, what do we have? We have procreative purpose without the unity purpose. We have this separation. A fertilization that takes place outside the context of sex, marital sex. Now, somebody will say, okay, sometimes it takes place within the context of sex when husband and wife meet. Maybe the woman has problem and can't carry the child. Now, another woman carries it. That's the surrogacy. But in this case, now, you now see the problem of a third party being brought in into a union that is honorable, that has that dignity. So looking at the dignity of probation, the church says no. For childless couples who are looking for child, surrogacy is not an option. But Francis recently is going to, there will be a document that will come out next week, sometime next week on surrogacy. In the document, the church is saying that surrogacy is deplorable. In fact, Pope Francis is linking it to child trafficking, that a child cannot be put at the mercy of human beings. The church believes that child is not a commodity. Child is not something that you can get the way you get a car or whatever, the way you get liver. You don't compare child with that of liver, sorry, that of kidney. Doing kidney transplants, therefore I can do that is child, human being. Imago Dei, Imago Dei, in the image and likeness of God. Every human being is created in the image and likeness of God. And that is the dignity that human beings have. That is the dignity that human beings have. That is why St. Paul tells us about the dignity of human beings, giving us the glory of human beings, that God created human being and made human being a little less than the gods. The church believes in the dignity of human being. And if a human being has that dignity, this human being cannot be gotten anywhere else. A child is not a product of something that is done in the lab, laboratory product. That is also why the reason why the church is against IVF. You don't get a child from the laboratory. You don't get a child anyhow. No, there is a dignity that accompanies procreation. There is a dignity that a child has. So the church focuses on this dignity because every human being has a soul, the likeness, the image of God. So the church says, no, you don't go and get this child anyhow you want. You go and impregnate somebody, you take the egg, you take the sperm, you give it to another person who carries. Child is not a commodity. So the church, looking at this ethical issue, this moral issue, says, no, you don't go for surrogacy. It is not an option. That is not an option. The church gives other options, you know. Of course, we usually talk about adoption. So anything that one does before the act of sex, within the act of sex, after the act of sex, that goes contrary to this unitive and procreative purpose of sex, the church is against it. The teaching may not make sense to you, you may not agree, but when you look at it from this angle of the likeness, the image and likeness of God, which every human being bears, you will understand the theological path the church is towing. And based on this, the church says, no, surrogacy is not an option. I think I have made my points on this. We now take one more person and we end our call. Okay, two more persons, we end the conference. Dr. A. Njoko and Mrs. Jacinta Mario. Dr. Njoko.
Yeah.
Good evening. I'm
God
just
bless you.
going to add to what Father and Mrs. Ilo already have said. One, I think that human beings or couples or singles are not to expect that they get what they want at all costs, and by all means, even when it means putting the other at risk. If we belong to a church or an organization and there is a constitution which every member, if you are a member of this, you accept this teaching or this constitution, I think as Catholics, we should be able to, in as much as accepting some teachings of the church is difficult, in this case, infertility or childless couple, it is difficult to accept, but it is also something that comes with grace to accept that, oh, I can't get children, or God has not given us children, but there are acceptable ways to try. If we succeed, yes. If not, is it possible to live happily married, childless? I think it is still possible. But to look out to say, what is God asking of us in this marriage, childless marriage we are in? Secondly, going for surrogacy or egg donation places the so-called donor. I don't even call them egg donors, because when you are donating, it should not be commercial. But egg donation we're looking at today and discussing is mainly commercial. So it is people harvesting other egg to make for business. And by doing that, you are placing the woman into health risk. You have gotten what you want, but the other person is at a disadvantage. So there is no justice in it. And this is what we have to think of. As a gynecologist in the clinic, most of the time you see that when these women for egg donor have been stimulated and they come out, because they have had hormonal dysregulation or imbalance, they come back and have their cycle disorganized. Some will not see their menses for quite a while. Others will have it irregular or when it's not expected, or even continuous bleeding. Then you have to now start treating them. So they are being placed at risk, the same as surrogate mothers. Many a time, to sustain the pregnancy, they are constantly hormonal supported. And who bears the brunt at the end of the day? Those who have the children or whom they are carrying the babies for, take their children and go, and the other person suffers the lifetime implication. So these are issues we should think of. We are not saying it is palatable to be childless, but what are the acceptable ways the church says? We cannot say the church should change the teaching to favor, but most of the time the church is wise that it looks at the implications of things and then encourages its members to accept it and go the way it should go. So these are the aspects I just want to add, because a lot has been already said.
God
Thank
bless you, Sister Anastasia. God bless you. Sister Sister Mario, you are the last person.
Thank you, Father, for granting me this opportunity. And I thank everyone for putting hands together to propagate our faith according to our profession or belief. Well, I thank Mrs. Adobe and Dr. Francis. You have all spoken well. Then to clear the air, especially as regards to our faith. I'm not good in quoting Bible, but as a pro-life, I want to remind all of us that the church takes the footstep of Christ the footstep that Christ laid down for us. Let's start from instance. In surrogacy, how do we trace the genealogy of these children? As Christ's genealogy was traced up to his third generation. In the case of having a child, like some people are saying, you help a woman or you help a couple to give birth to a child. We forgot that the act of sex is sacred, as it is written in the Bible. And a marriage is not meant for childbearing alone. It's meant for burden, to practice Christ-like agape marriage. And we should also reflect back to what happened to Sarah, Abraham, and Hagar. The issue of intratribal and war every country now, or the opposite religion we have in the world, is still that. But who will change the wish of God? And the word of God said, I will like whom I chose, I've chosen, and I'll bless whom I want to bless. And it's also biblical that some are made Enoch for the glory of God. We should not also forget that you use nothing to compare adoption and surrogacy, because all of us have sinned and come short of the glory of God. We are all adopted children of God. Then in surrogacy, what do we have to give an account? Or like the earlier speakers have said, to tell these children, because the truth cannot be hidden forever. And the psychological trauma and the crises and evils that will be associated to it later. This now made me to appeal to all Catholics, especially those in the medical field, to wake up and evangelize our faith. Things are really going wrong in the medical practice. Because if, in fact, I will blame us in the medical practice. Most of us are because of love of money. We keep our faith by the side. We know that this egg harvesting is indirect way of committing murder. We know what we are inflicting to those innocent souls who don't have an idea of what goes on in their system, either now or later. So I'm thanking the Father Founder, and I'm thanking all of us that are making our time to dialogue and reason together. To some of our brethren that are still doubting or talking about civilization, I don't think anybody can be wiser. Remember, everybody has a tribe, and God knows us and placed us in those tribes. He's not a fool when he told who told Isaac to go to his fatherland to get a wife. So there's a lot of things that when we follow medically, compare it religiously, we see that we still have our faith. So Mother of Perpetual Help will help us.
Thank you.
Thank you, everyone.
Thank you,
Thank you.
Mrs. Semagi. With this, we come to the end of our program. I hope all the questions have been answered. How do we test the genealogy? Okay, that's the point made. It's not marriage is meant to give birth. Is all marriage meant to give birth? Is that the question or what? Of course, every marriage is open to procreation. But there are marriages that may not bring about that procreation. Okay, that is where we have the issue of adoption comes in. Okay, in fact, there are people that marry, they know that eventually they may not have children. That does not mean that their marriage is not valid. Their marriage is valid provided that there is that openness to procreation, to generation of life. Thank you. Okay, I think that's all the questions. Someone said that we should encourage all females to consider marrying on time. But my dear, it's not their fault sometimes. There are many females who are ready to marry, but they haven't found a suitable suitor. They haven't found someone that they want. We are not going to force them to enter into marriage. But I don't think there is a young lady who intentionally waits to get married when she's old. That's not even logical. Many that are not married, I don't think that it's their own fault. I don't think it's their own fault. But those who want to marry at their old age, I don't know. That's what I can say about that. So, dear young people here, I'm encouraging you to marry on time. God bless you. Okay, the other question, I think these other questions have been answered. Any question that is not being answered, you can bring it up in our different WhatsApp groups. They can be attended to. We have to end the conference so that you don't become too long. I appreciate all of us. In a special way, I appreciate our dear speakers tonight, Mrs. Adobe. I appreciate Dr. Francis. I also appreciate Sister Priska, who sends her slides to us. I appreciate you all. God bless you for your wonderful presentations. All our dear contributors, God bless you. All participants, I thank you for making our time to be part of this program. Thank you. This seminar is being recorded. After the recording, I will edit it. I will send it to us. I will send it to the singles group, to the married group. Those who do not belong to any of this group, you can send me your WhatsApp number in this chat right now so that you can be added in the singles group or married group, or it can be sent to you directly on your WhatsApp for you to get the record of this. Please, if the knowledge we have gained today, let us do well to disseminate it. Those who are not here, the information can be useful to those who are not here, please. Thank you, and God bless you all. At this point, I now call on Sister Rosanna to lead us in closing prayer while I give final blessing.